Okay, so I'm leading discussion this week. Thanks everyone for coming. I will attempt to share out my screen. Can everyone see that okay?
Yes, I can see.
Okay. So predictably enough, I get all kicked off at work in this week, so you may have to bear with me, but we'll see how we go anyway. So this week we're going to look at chapter 3, methods and calculations. Last week, just briefly recap chapter 2 because it flows nicely into this week's discussion and topic. So last week we looked at metrics that quantify the burden of a disease. In particular, we considered the makeup of the DALY, or disability adjusted life year, which is the sum of years of life lost and years lived with disability, YLL and YLD respectively. YLL's years of life lost represent the years lost due to premature death, whilst YLD's years lived with disability capture the impact of disability. And these metrics were important because policymakers will want to quantify the impact of diseases, where they're more severe, and how they're affected by interventions. So in this week's chapter, we're going to consider how to calculate years of life lost and years lived with disability, so we can calculate a DALY, as well as briefly looking at the calculation for healthy life expectancy, HLE, which measures the difference between life expectancy and the years lived with disability. Some of these calculations might get a bit dry, I suppose, but hopefully we'll get out the other side and a little bit wiser. The building blocks of YLLs and YLDs are the components of both. So we do need to be able to compute them to work out DALY and healthy life expectancy measures. So we'll start with looking at years of lives lost, YLLs. This measures like the number of years lost due to a premature death. The concept originated in the 1940s, conceptualized by Hainsel and Dempsey. Which a little bit about Hainsel last week. This calculation, again, helps policymakers understand which diseases cause the greatest premature mortality. And it's calculated as the product of N, the number of premature deaths, and LE, the standard remaining life expectancy at the age of death, to give the total amount of lost years due to that death. Now, to allow cross-country comparisons, standardized life tables can be used to quantify the life expectancy, so you can ensure you're comparing two populations equally. Okay, so we'll run through one of the examples from the book. Follow along if you wish. Got the code coming up. This calculates, we're looking at calculating the years of life lost due to stroke using the Global Burden of Disease Study 2019. Data and functions are present in the HMSIDWR package, which accompanies the book. If you want to follow along, to install the package, we're just going to use the CRAN version and the standard install packages function to get up a library to load it in. We'll also load in the tidyverse suite of packages. Again, that's kind of like outside the scope of our discussion, but it is a popular suite of packages that hopefully you should be at least familiar with on a basic level. And we're going to use some dplyr functions from the tidyverse in the second chunk to filter the deaths 2019 data set down to strokes. Pick out columns from there. So if you are following along and you run this code, what you will get is a tibble or table object at the end, which named deaths underscore stroke, which contains the excess deaths due to stroke split by sex and age. There's DX and B excess deaths there. Now, you can have omitted the visualization for the book here, just in the interest of time and space, but there is a nice visualization in the book showing a box plot of how stroke deaths are higher with age. That's quite interesting. To carry on with the calculation, we are going to firstly filter the data a little bit. So it's this chunk here extracts the relevant life tables to get life expectancies for 2019. So we start that condition there, and then renames it the value to LE as in our prior definition. So we now have life expectancies and excess deaths from strokes split by age and sex, and we can join these together. Okay, just use a full join function here, and then calculate the YLLs just by mutate function in the join data set to get years of life lost due to stroke. So if you have a look at that data set that we've computed, you should get something with this structure here. And if you plot it or even just eyeball it, really, you can see YLLs being higher in all the groups, higher in older females as well, I guess, because you would expect them to have slightly longer life expectancies than men. The second component of the DALI is years lived with disability, or YLDs, which we're going to go on to calculate now. These measure the burden of non-fatal diseases by accounting for the disability duration and disability severity. The formula used varies depending on whether we're basing it on incidence, which is new cases, or prevalence, the total existing cases. The formula uses disability weights to quantify the severity of conditions. It can be quite difficult to standardize. It's given the variation in how people are affected by disability and also comparisons across different diseases. So again, we're going to run through the chapter example to demonstrate calculation using stroke as an example. We're going to follow the WHO method of using a prevalence-based calculation rather than incidence-based. There are disability weights available in the dis weights table within the book package. This provides severity-based observations. We characterize stroke severity into mild, moderate, and severe levels. We're going to use an assumed distribution of stroke severity. So we're going to take it that 50.3% of cases are mild, 25.3 cases are moderate and 24.4 cases are severe. The provided R code assigns those assumed proportions to each severity category, and then computes average disability weights by working out the mean of disability weight in each stroke category. So if you're following along, you should end up with an appropriate data frame at the end of that. And then I've got this slide which walks through the final calculation to give us our years lost, years lived with disability, sorry. There is a prevalence-based formula which assigns YLDs based on the distribution that we've assumed. We calculate this by multiplying prevalence or incidence data that's found in the package by severity underscore n, which is our assumed distribution of the various stroke severities, and then multiply that result by the average disability rate to get the years lost. If we are using the incidence rate, that's converted to years by multiplying by the ratio of the average duration, which here we're assuming 28 days divided by 365 days in a year. The final step is to then sum each of the YLDs in each severity category to get total YLDs, which can then be plotted or used in the DALI calculation. And if you've got as far as this, you can work those out. There's a nice little visualization in the book. Just plotting the sum of these and standardizing them. So it's obviously fairly trivial to add years of life lost and years lived with disability together to get the DALI. So I won't demonstrate those. We'll just look at the results from this example, where we can see that burden's falling mostly on older persons, firstly, and at very low and very high ages, there are proportionally more loss from years of life lost, death, whereas the reverse is true for, I guess, this working age, I suppose you would say, interval, where there's more of a loss from YLD, years lived with disability. Okay, maybe just skip that a bit. So once we've created DALIs, we can use these to inform public health strategies, as we discussed a little bit last week. We can quantify the disease burden across different areas that may not be on the face of it comparable. Being able to calculate DALIs will allow us to prioritize interventions and allocate resources and accordingly, and measure the effectiveness of certain programs over time if we have data for that period. By making it all comparable, DALIs are quite useful for global health assessments and inter-country comparisons, even where there are differences in populations and health systems and those kind of things. And yeah, we can use DALIs to help us track trends in the disease burden and the effectiveness of particular interventions over time. Okay, so the final calculation to cover is healthy life expectancy. And this is, I guess, used more for measuring population level health. So it kind of refines life expectancy by subtracting the years lived with disability. So you get a measure of years lived in good health, I suppose. This involves, to calculate this involves working out the average health of individuals in age groups over the population, and then integrating some information on the prevalence of various conditions and the associated disability rates. It can be adjusted, or I guess you could have a more a richer model by using simulations to account for things like comorbidities and exposure to other conditions, or particularly ones which are communicable, I guess. We won't do the example, I think, for reasons of time. But if you do want to follow along with that, then you can look at section 3.5 in the book to cover that in more detail. Okay, so to wrap up a little bit, we've looked at YLLs, YLDs, and DALYs, some of those, as well as the healthy life expectancy calculation. These first three help us assess the disease impact of both mortality and disability levels. The healthy life expectancy metric extends kind of our ability to look at population level health by measuring the years lived in good health. And then I guess the final point is, yeah, as long as these metrics are there, but they continue to evolve, as do methodologies used in global health assessments. So we can, I suppose, expect these metrics to develop as well to better capture new health issues and outcomes for things like that become more of an issue, appreciated more, like mental health and other health conditions that become more prevalent in future. Okay, I will stop there, I guess, and we can have a discussion, or if there's any questions, comments, or anything like that.
Just a general comment. I mean, thanks for the presentation. I think the pace was really nice. I'm looking at the data, and it seems it's a really nice data set for demonstrating. My knowledge of this is not very detailed. I've only recently started working in public health, and I'm doing a public health intelligence training course through government health department. They offer training for people working in this area. So we've only gone over very superficial things, and I think the detail in the book and the key points in the presentation are actually really useful to be able to figure out and understand how these calculations work and the kind of statistical principles, epidemiology. I think it's absolutely brilliant example, and I think it's something I'd quite like to share with the cohort of people I'm training with across different aspects of health and public health intelligence in the UK, because I think it's such a valuable piece of work. So it's more a comment than a question, really. I think it's really good. So thank you for that, and for the materials, for Federica for bringing this to us and putting it together. It's really fantastic.
Thank you.
I guess a kind of a question that occurred to me when I was putting together like this chapter, and maybe this is covered later in the book, but I haven't read that far yet, is how difficult is it to come up with consistent disability weights? Because I guess you have, I don't know, maybe you have things like exercises where you ask people to like trade off, like I suppose you have this for qualies where you ask people to trade off one health state for another, and then you can draw out I guess a weight or a comparison for that state versus full health. But that must be quite an exhausting amount of work to keep those current if you assume that people's preferences to change or people's preferences change over time. So I guess a question maybe for Federica is like, to what extent are these weights updated? Are there ones that are quite old that people recognize are quite old, but nobody's done the research to update them?
Yeah, no, the weights are set. Just an example, and they are from an article which is cited in the chapter, and obviously they're quite difficult to calculate and to assess the level, and so the consideration for deciding which level of weights has to be assigned for a particular disease, it's really it's really important because it changes a lot. If the level of the weights is different, the level of the metrics changes. So it depends by several factors, but in general, for some diseases, for example, such as stroke in this case, they quite vary, but because it depends by even because of if the manifestation of morbidities, and so in this case they did a study and set these three levels, such as high, moderate, and low level of outcomes. Okay, when after you have had this terrible disease, you can be affected with severe consequence, or just even just with no consequences apparently, and so to set a correct, let's say, to be able to trust these levels of weights, it's very depending by the population type, by the age level, the lifestyle. So many things get involved in identify the correct level of weight. But, you know, just to give you an idea, and to give myself an idea of what's happening when I calculate this level of disabilities and how this disability will affect the metrics, to be able to compare in case of this such as disease, the impact of this disease within other countries. I just decided to set this, you know, a certain level of weights that have been agreed within a study that was the most. Obviously, that it can be different, different countries, different situation, and they can even give you a fourth level within the just top, high and low and the middle level. So you might have four. You can find 4 levels instead of just 3. That's quite interesting. That's quite interesting. And it is within the research. So it's an ongoing study to be able to assess a standard level of weights for certain type of diseases within different countries.
And do you find, just I guess as a follow-up, do you find that there's much variation between countries? Do people value certain health states differently in particular types of country?
You always need to. I don't really found much variation, because you know that they are usually assigned. But this depends on, for example, on the level of life expectancies. Just to give you an idea, this might, if as well as you can visually see the differences within life expectancy within countries, as well you can expect a different level of severities for some senses. But it's, you know, it's too, maybe sound superficial just to say that the most correct way to assess those weights is to focalize on a certain type of population, even if it's just like restricted population within a country, such as group of a certain age group, or by sex, by gender, or by the level of employment. Like this might affect these differences, but overall, in general, you can use general outcome. And so for center, you know, if you're affected of a stroke, and then you as a consequence have like paralysis or things, so the weight of the disability for that for that outcome is common for everyone. But the frequency that might happen might be linked to other things, such as the group, the population, the location, the age, and everything. And so that might vary in that sense. But in general, if you use age standardized, and you can assume that the outcome for that disease might have a certain general level of severity. And this is what is used within the insurance companies as well, because when they provide, you know, reimbursements for claims and things, and so they consider certain level of severity that will affect those things. And in some senses, it has to be standardized. to cover the population, even if they consider your the category single individual may belong to, but it's usually it's an interesting, very interesting topic, but somehow has to be taken in under a general manner to be able to be generalized for the entire population. Yeah.
Oh, I'm still muted. Yeah, I had to multitask babysitting my baby sister and the book club. She kept insisting I add her name up there, so I had to. But a great presentation, Rob. Enjoying reading the book so far. It's really great, Federica. I think it's interesting that we have to categorize life expectancy for different countries because it's pretty obvious that people live to different years in different countries depending on other factors like economic, social, cultural factors. So I have a sort of question. This may be something I missed out on while I was having divided attention. But when we talk about years of life lost, it's comparing the age, the individual or age of death, premature death, to a standard in quotes. And that standard, is it the life expectancy of the country where the discussion is happening, of the country of concern? Because I'm wondering if, for example, the wait, please. Just all right. So if we're talking about the the years of life lost with stroke, and we're we are making that comparison in a country where stroke is pretty prevalent, doesn't that affect the life expectancy of that country already? I don't know if I'm doing a good job phrasing my question.
Okay. Yeah, that's the reason so I've chosen that particular disease, and even within so you can identify the level which is higher within some countries more than others, and so this is basically, we are talking about not fatal diseases, so fatal outcomes, but when they get into there is more to see. Of course, you cannot, so that there is something that might lead to that, and that will take some years off from the expected number of years of life expectancy that that person could have had if wasn't affected by a stroke, for example, in this case. So yeah, it will obviously it's important to consider the level of life expectancies as well as the other. So that's a first step that you always need to take consideration of when you have when you like to provide an overall picture of the what's happening in a certain country and then to be able to compare with other countries. I don't know if I've answered your question, but you might want to, ask again or say.
Okay. Yeah, you covered a huge part of it. So this is a kind of discussion, of course. I want to, would it be so fair to, would it be fair to compare the life of an individual in a particular country with the life expectancy of another country, say a country where the disease is not so prevalent? Because I think beyond the disease, there are other reasons why this other country has a longer life expectancy than maybe the country where stroke is prevalent. I was just trying to wrap my head around how exactly years of life lost.
That's a great question, and it sounds interesting as well. So obviously, it depends what type of question are you answering. If you like to focus on the impact of that particular disease, you might want you might want to restrict your population to those one affected by it. And then you might want to compare a country with or a situation aside, so which is free of stroke in this case, such as free of this disease, and see how the disease has affected the population. So then you can compare with and without. Yes.
That's great. Thank you. Yeah.
And just on that point, I wondered if you wanted to take equity, I guess, more into account for things like that. If you're comparing disease burden in countries that have different life expectancies, would one way to do it be to weight earlier years higher than later years of life in the calculation? So you have, like, I guess, a weighted years of life lost, where years lost in the 20s are weighted slightly more than years lost in the 80s, 90s. Obviously, that opens up the whole philosophical issue about the value of life at certain points, but that could be one way of dealing with that issue of differing life expectancies. I don't know if that's ever done in practice, so but yeah, that's just strikes me as one way of doing that.
That's great. Yes, we need to think about that. Yes, of course. And you compare the weight. Yeah, of course. If you think that life was shorter, and now life is. But you can even do that by comparing different countries, life expectancies within different countries. For example, Japan has a longer life expectancy than just the US, for example. So, yeah.
I have a question about things like public health interventions, because you're measuring, things like dailies and the impact of certain diseases. But for things, if you wanted to take that and understand differences that may have occurred as a result of an intervention or some kind of approach, if you have something that seems excessive, you look at how other countries are performing in a certain way and you think, well, we need to do something. how could you use that? How would that work in terms of looking at an intervention that might have occurred? Because it's not always obvious from the data, is it? When you look at, you can see that there might be a change. I think there was a time 20 years ago, for example, the UK had higher rates of vaccinations for measles for children, and Europe was much further behind, but now it's improved, and it could be for a range of different reasons. So I'm kind of, I suppose, curious about where you might look to find data to understand that, or whether there are approaches you can use if you do something in your local area, to try and understand the impact of those interventions, which I think might be complicated, but it's something that we're interested in doing, certainly in my role and in my job. I wondered if you could offer any suggestions or advice about that.
Yeah, there is I don't know if you are thinking about using data, for example. Obviously, you have the chance to put your, we will see within the book how to model different situations, such as the impact of vaccinations and things, or other. I just briefly shown how to identify these different levels of disease impact. But when looking at just, over at DALYs, and you have just the number of DALYs, so the number of years taken by a population out of healthy life, you can then just take these numbers and very, synthetically compare these numbers to the numbers of another countries. And this is very useful to see very quickly, focusing on a disease such as stroke. What are the differences within countries? How many years have been taken by this disease in Japan, rather than the UK or the US or any other countries. So you can see this is why it's a widely used type of metric. When you want to go inside of an intervention, you think about the number of DALYs, but then you need to go a bit of deeper inside of the situation and look at, if in case of measles, vaccination, how the vaccination changes, how many, what proportion of the population has been vaccinated, if you have reached, a level of coverage that will assure that the population will be free of this infection, viral infection, even within the future, how many years. So there's many things to consider, but there is a nice way to apply this when you have data within a model, and that will set up your mind and say that population has been affected by this viral disease, but if we are able to vaccinate and cover a certain proportion of this population, we can safely say that we will be out of it within a certain period of time. So that is nice, even within vaccination, even within social contacts, for diseases that are transmissible with physical contact and things. And it is as well very, very interesting. So I also can suggest you, I'll post it on Slack maybe later, a nice, it's a course you can take it the word specialization, or you can just have a look at the course. They go through this step-by-step of modeling viral diseases and touching the vaccinations and things. So I'll post this later on Slack, so for you to have a look at it, because I found it amazing. So I warmly suggest you, if you are interested in the topic, to have a look at it, because it teaches you a lot. So
Okay, thank you. That'd be absolutely brilliant. Thank you very much.
okay, I think it's next we are good to for this session. More or less we covered everything. So next week we have a chapter for matrix components with Peter. So thank you. So we look forward to it. And then we'll see for chapter 5 what's gonna happen. If you have done a chapter and you want to do another, you are very welcome. So don't be afraid to say I done a chapter, I can't do another. So, book club is yours, so you can do whatever you like. I think we are good to go.
Thank you.
Thank you.
Thank you.
Thank you.